meanwhile, as many of us look forward to summer, a new study suggests family picnics, firing up the grill, or even visiting your neighborhood park may hold more value than just fun and relaxation. Joanna Frank with the Center for Active Design joins us now with how this all plays a key role in boosting mental health. Joanna, good morning to you. Thanks for joining us.
Hi, good morning.
Good morning. So I know that May was Mental Health Month and it is June 1st, but we can talk about mental health year round. Why is this so important? And it's beyond just having fun in a park.
Absolutely. Yeah, no. So there's a lot of research, 100 years of research, actually, that shows us that being in nature, so being in a park, any kind of nature, is going to reduce our anxiety, reduce our stress levels in a really measurable way. And then being in a park itself with lots of other people, with your community, that is a great antidote to social isolation. And what we see from the research is that being lonely, which I think all of us understand what that feels like during COVID, and being isolated, it actually has the same impact on your overall life expectancy as smoking 15 cigarettes a day. So it has a really significant impact on our quality of life and our life expectancy. And parks obviously are a great place to go socialize, see your neighbors, just hang out and be with other people. So a lot of benefits to being in nature and being in a park specifically.
And we're really reaping the benefits here in the nation's capital because they looked at all the parks nationwide, hundreds of parks, and DC ranked #1. So we've got some gems right here in our own backyard.
Absolutely. Yeah, no. So DC was #1 in the country. And then Arlington actually was #5 in the country. So your whole region has great parks. And what we mean by great parks is that not only do you have access, and for us to feel like a park is our park, it actually has to be within a 10-minute walk of where we live or where we work. So that's our feeling of ownership is that kind of quite close to a park for it to feel like ours. And then also like how well maintained the park is. It's essential that you don't just have a green space, but that green space has to be really well maintained. The plants have to be in great condition. And if you start seeing litter or any kind of deterioration, then that's actually going to really have a big impact on our levels of trust. So very interesting how we perceive the world. And if somewhere is really well maintained, like green space, it actually makes us more inclined to trust our neighbors, more inclined to trust police, government, et cetera. It has a really profound impact on our feelings of safety and trust associated with how well maintained green spaces. And so obviously DC and Arlington are doing an excellent job because that's one of the critical factors in looking at a park score.
Joanna, you all at the Center for Active Design have partnered with the CDC to conduct some research. What's the big takeaway? What are the top 3 nuggets of information that you've learned?
I think that first and foremost is that where we live and where we work, so our built environment, both our neighborhoods and our buildings, they have a profound impact on our overall quality of life and our health. And I think folks didn't really understand that, but now we do. And as I mentioned at the beginning, there's 100 years of research. Like our organization has 7,000 peer-reviewed research studies coming from academic institutions all around the world. We really understand how our buildings and our neighborhoods are impacting our physical health, our mental health, as well as our social health, like our willingness to trust one another in the community. And we can leverage this information and actually we can now define what is a health promoting environment. So I think we've always felt that connection to nature or parks. We know it makes us feel good, but now we can really quantify it. So I think all of this is now being used to really understand how do I optimize my buildings, my neighborhoods for the people that they're designed for. So I think it's an exciting moment that because of COVID, a lot of people now understand the relationship, they feel the relationship between their buildings and their neighborhoods and their health. And we also have the research to really understand how to optimize it. So we're in a good moment as far as we're empowered, right? We know what to do. So having parks is a fantastic start, a great investment in our communities.
Wonderful. Joanna, we got to go, but thank you so much for sharing that information.